Thoughts on. Thank you for being here, everybody that's online. Thank you for the folks of Nona Media, Reese Lynn, MS2 here in Lake Nona Town Center, Juan Santos, and for the folks that are always here with us. And we have today a guest, Dr. Lourdes Benes. How are you today?
Hi, thank you. Thank you for having me. I'm good, and you?
Doing well, thank you, doing well. Dr. Benes, we have a very important topic to talk about today, but before we jump in, can you please give the audience a little bit of background on who you are and what inspired you to get involved in the field of neurology?
Yeah, so I'm Luly. That's my nickname.
Okay.
And I would like everybody to know me, not as Dr. Benes, but as a person, as you are, right? As everybody else is. So I am Luly. I'm the oldest of three girls, born and raised in Puerto Rico. My mom and my dad, raised us over there. We went to college over there, playing tennis. Always very important to study, but to play a sport and to be active, right? My dad is a GYN, a gynecologist. So I'm coming from a family of some doctors, my grandfather as well. And seeing what he did, or what he still does actually, got my attention into medicine. But I didn't know the field in particular, or the specialty in particular, until my youngest sister, had a seizure. So my youngest sister had a seizure when she was 15. I was 17 or so. And seeing her going through that, actually, is when I started reading about neurology to trying to help her. And that got my attention, right? So that's how I started studying medicine, and then I went into neurology. I married my college sweetheart, and we have been together since then. Did my residency in University of South Florida in Tampa. And then I had kids when I was older, actually. I had kids, I was telling you, Gustavo, I was 38 years old when I had him. And then Victoria and Camila, which are twins, I had them at 40. So that's how I started, and that's how I got into neurology and got involved into that. And I was living my life that I thought it was the perfect life in Puerto Rico. Had a good job, used to live in front of the beach with all the family, and Hurricane Maria came, right? Mm-hmm. And I don't have to tell you the story. You know what happened, right? The whole island was affected, and I was not excluded. So I went from living in front of the beach with a nice car and everything to losing my job, right? Like, my building was destroyed, literally. So waking up and going and seeing that is a very humbling experience. And having my kids very young, right? Back then, the twins were 6 months old. Gustavo was 2 years old, doing and making lines that were 2-3 hours for them to give you like a couple of bottles of water, and having to feed your kids like that is when we said, we have to move, we have to do something. Because now it's not about AC. If I have air conditioner, I can blow my hair or whatever, right? It's about feeding my family. And we came back. We came to Orlando. I keep very good relationship with my mentors. I graduated back in 2008, and I still talk to them frequently, and they gave me the opportunity again to start all over. They offered me a job, and actually I accept, but not as an offer for the job, but rather to start studying again. So I came back, and I did 2 fellowships in movement disorder and in cognitive, in memory disorders. And that's how, where I am right now. So seeing from adversity an opportunity, maybe. It was in front of me, and either I sit down and I cry and I, just see what happened and who can help me, or we move on and we do what we need to do. And that's what I did, and I have my family to back me up. My husband was there at my side. My kids were young, and that's how I end up here talking to you right now.
Oh, that's a wonderful story. Thank you for sharing. Mm-hmm. So let's jump in. You're in a field that, at least to my eyes, is getting more and more attention, and for all the right reasons, and in part because of technological advancements that allow doctors and researchers to learn a bit more about the brain. But if you ask the average person to say what's the difference between neuroscience, neurology,
it's very confusing.
It's very confusing, right? So correct me if I'm wrong, but neurology is kind of a subset of neuroscience in the sense that these are MDs, neurologists are MDs, medical doctors that study the maladies, of the nervous system, yes. Right? Whereas in neuroscience, you probably have a PhD. Some neuroscientists may have an MD, but they're more researchers. They're doing studies. They're trying to study how exactly the brain works.
Yes.
Right? Am I on track here?
Yes, very much so. So I see us as a team more than anything. We're collaborators. So I'm in the trenches. I'm seeing the patients, and they're in the research, giving me the resources to be able to treat people. So I think we both collaborate, we need each other. And yes, we go to medical, in my case, the neurologist, we go to medical school, and after we do our residency in neurology, that is 4 years. And basically is everything related to the brain and the spinal cord and the nervous system. So that includes also the nerve that, the peripheral nervous system that go to your legs, to your arms. So it's not only on the brain, but it's basically studying the main computer, right? And it's a very, very challenging field because we don't see, right? It's one of those, if you go for a dermatologist, they can just do a biopsy and see it under a microscope. If you have an abdominal pain and they don't know what it is, they can do an exploratory, right? A surgery to see what's happening. But for the brain, what do you do? Are you gonna open the head and then just, it's not easy. And that's why it has been, I would say, like a dark science for so long. And it's a field that a lot of people don't like to go into because they don't know, right? Because we don't know. We still don't know. Even internists that they study their 4 years, when there's a neurological problem, they immediately refer the patient. They don't even try what's going on over there. Nowadays, as you said, as you very well said, we do have advances that include radiological technologies that can help us see what is happening in that black box, right? So a black box in an airplane, you only see what's going on when the airplane is, right? So that's the brain, basically. But right now with technologies such as PET scan, for example, so nuclear medicine, we can see what's happening in the brain. With genetic testing as well, we know what's going on. So we are seeing a little bit more, and that helps us also not only understand the pathology, but look for different alternatives as treatment and more so for prevention. A lot of our conditions that we treat in neurology, most of them are chronic. That doesn't mean that you're gonna die because of the condition, but you die with the condition, right? So I would say all of the patients that I see, when I introduce myself, I tell them, you're married to your wife and you're married to me. Because this is until the end, you know what I'm saying? We're gonna be here together because most of those conditions are chronic. But giving them hope and being able to know that now we have treatment options that can help prolong your life and live a very good quality of life is important, because it's not a matter of living 100 years and 30 of those in a nursing home, than rather to have good quality of life of whatever you're gonna be living.
This is very interesting. So my father is an MD as well. He's retired, also an OBGYN. So I do have that. It's, I guess for those of us who are children of doctors, we grow up in a very special household listening to conversations. And I did not become a doctor to his disappointment. I became an engineer. But you said something that I want to immediately dive into, because I think one of the benefits of, and please keep me honest, one of the benefits of the technological advancements that give you tools to understand better what's going on is the fact that we can now have a little bit better understanding of what to do so certain things don't happen. The whole world of prevention, yes. Right? For a long, long time, medicine has been a very reactive practice where, the person has to get sick, and then you treat the disease or the ailment. And now we are getting into exciting times because as we're learning, we're also learning some of the causes, and we can teach prevention. In your day-to-day, do you see the same thing? Do you see yourself helping people prevent? Or are you mainly occupied helping people recover or live with a disease?
So that's a very good question, and I love that you actually did it. So both, right? Because nowadays, giving hope and alternative for somebody that already have the condition. So having the tools of different medicines that can help is pretty good, and it's very rewarding for the patient and for myself. But my special project and what I believe 100% is in prevention. So I think they should go hand in hand. I would not say like we can do just one and not the other. But definitely, if I have to put my money on something, I would do it on prevention. So prevention, I have a hard time convincing the patients about this. It's nothing that we are wired or used to hear all the time. We know about the conditions, we know about the medicines, because unfortunately, the things that are on the media, on the TV, on the advertising, are the things that are being paid or advertising by pharmaceutical companies. And nothing wrong with that. We need them. I'm not going against them. I'm just saying that then who talks about prevention? I mean, they're not going to pay me to talk about not getting the condition, but they will pay me to talk about the medicine that is there to treat the condition, right? So it's in podcasts like yours that we actually can get to a lot of other people that are listening to us, and that actually can start, knowing that there's something happening, that there is something going on, to get educated on that, to look for good information. Where do I read about that? Who do I listen about that? Where do I go? Where can I check my brain, in my particular case, before the condition happens? You know when you have to do your colonoscopy. I know when I have to do my mammogram. Do you know when you have to go and check your brain?
No.
So you wait until you have the problem, and then you knock on my door. And then, yes, I have the medicine to give you. But that should not be the process, right? That should not be the process. What can we do on time to see, how can I prevent certain things? There's certain things that you cannot do anything, and I cannot do anything. I cannot do anything with your genetics. I cannot do anything with your age. And they're both risk factors for memory problems. Let's put that example, right? But there's a lot of other things that can be done for other risk factors. They're time consuming, and they're not nice, or they're not easy, and we're used to be in the comfort zone, right? So you give me the medicine for the cholesterol, rather than me going and walking or running or doing the diet, just because comfort is easier for us. But yes, if we're educated about it and we hear how it is and we put our effort on that, a lot of the conditions can be prevented, and the ones that are not preventive because are genetic, for example, you could at least, the goal would be to be independent the longest, that you can manage the condition that you have, but that you can remain independent the longest period of time. That would be the goal for those risks that I cannot change.
So let's talk about the conditions. We've been talking about preventing or dealing with conditions. What are some of the conditions that fall under the umbrella of what you do? So
in particular, I did the fellowship in cognitive and Parkinson's. There are two different conditions, but both of them are neurodegenerative. So in movement disorders, there's a very broad amount of conditions that go under that umbrella, that goes from Parkinson's and Parkinson's-like symptoms or Parkinson's-like conditions. In the Parkinson's-like, we have multiple system atrophy, we have corticobasal degeneration, we have dementia of Lewy body. There is a gamma of those. We have essential tremors as well, Huntington's. So movement disorders is a field on its own, right? But more common, we have the neurodegenerative diseases such as Alzheimer's. So dementia, issues with the memory in general. In particular, Alzheimer's affects 6.7 million Americans right now, and those are the ones that have been diagnosed. You can imagine how many have not even gone to the doctor and they think that what they have is normal for their age, or they just have been misdiagnosed with a psychiatric condition. How many of the patients are under the psych ward and are being labeled as they are, demented, they're crazy, or however they want to call it, and they never reach, or they may have another diagnosis. So that's a condition that is just becoming more prevalent, and each year we have more and more cases. And not even talking about our population, the Hispanics, that we're even more at risk compared to the white Americans, and the same happened with the African Americans. And even though our risk is higher, most of them don't get to the doctor. They don't do it because they're not being understood, because they're afraid, because even the term of dementia, for us, it means something different, right? It means you're out of your mind, right? Mm-hmm. So how do you do that? How do you do that approach? How do you tell them, go and be checked? We are at a higher risk. It's been very, very difficult for the doctors to spread the word about this. So under these cognitive disorders, Alzheimer's is one of them. It's the most common cause of dementia after 65 years old, but there's other types of dementia as well. And by the way, Alzheimer's can happen in younger people. It's just that it's less common. You can have vascular dementia, and that vascular dementia is due to strokes, and the same risk factors that would affect your heart can affect your brain. Frontotemporal dementia is another type of dementia that usually presents with behavioral changes, so different from Alzheimer's, right? Then you have Lewy body dementia that have a lot of hallucinations, but also have Parkinson's-like symptoms. You have dementia due to other conditions, even due to traumatic brain injury. So there's the list is huge, right? But the most common one, and that most of the people will hear about, is Alzheimer's, just because it's the most common one after 65. Mm-hmm.
So there's a lot there that I want to cover. So you mentioned Lewy body a couple of times. That was the Robin Williams disease that took his life.
Yes, that's correct.
It was incredible for me to watch the special, because you can't see it until after the person has passed.
Yes.
So there's a subset of all the stuff that you talked about that only can be seen or diagnosed after the person has passed, if you get a sample of what was going on physically in there. Mm-hmm. And you also mentioned plaque, so I want to kind of correlate that. You mentioned the same type of problems that you can have cardiovascularly related to plaque. There's an equivalent correlator in the brain where the plaque accumulates, and now neurons can't talk to each other, and that creates all kinds of dysfunction. So it seems to be, correct me if I'm wrong, that if from a preventive point of view, if I do the things that I need to do with my diet and movement to help my heart, I'm also helping my brain.
That's correct. That's correct. And let me clarify that a little bit. And you're correct about that, and we're going to talk about that. So remember that the heart will pump the blood also, obviously, to the brain. So anything that affects the heart, anything that would cause the arteries not to be like narrower, would actually cause the same problem in the brain. Now, the arteries in the brain are smaller than the ones of the heart, right? So they don't need even that much to cause a problem. And sometimes you are affecting the smallest vessels of your brain, and you're not even aware of that. So you can have somebody that is just showing up in the clinic for a headache or having some memory problems, and you see that MRI, and it's full of white spots. That means small vessels that have been affected for some time, right? And then you have to look at the risk factors, and if you see are the same ones for the heart. So that would include cholesterol, that would include blood pressure, that includes as well, any kind of issues with the heart, like heart failure or arrhythmias, smoking. It would include also air pollution, not sleeping well, stress. The same things that affect the heart would affect the brain. Now, the plaques, so that would be cholesterol plaques that I was saying inside the arteries. Now, there are other plaques that we can talk about, and that is for Alzheimer's in particular. So Alzheimer's pathology, we think, is multifactorial. It has a lot of different things that may be happening, and we're finding more and more different reasons for the longest we know period of time that tau and beta amyloid, which are two different proteins that can accumulate in an abnormal brain in the brain, are the main pathology of Alzheimer's. So beta amyloid would be the plaques in between the cells, so they would not allow the cells to talk to each other, and tau would be the ones that accumulate inside the cell. So they basically kill the cell from the in to the outside, right? So they both do a lot of damage. We think tau might be a little bit more for cognition the problem, because right now we do have medicines that would slow the progression of the condition by removing the plaques of beta amyloid, but we only do that for about 30% of so. So what else is that 70%? Is that tau, or is that what? And we have found that actually vascular process in the brain has something to do with that, and inflammation as well, insulin resistance in the brain as well. All of those things are linked to a higher risk of having Alzheimer's. And that's the target of the newer medications. They're looking for the GLP-1 medications, like the ones that they use for diabetes and for weight loss. They're using it for Alzheimer's. Because if in fact there is an insulin resistance in the brain that increases the chances of having Alzheimer's, why don't we treat that and we see what's going on? And so far, that result seems to be very promising. So we may be using those medicines in the near future to treat Alzheimer's as well. And the same with the vascular process. We have seen how vascular process actually are linked with Alzheimer's. So you see how now the pathology that was before thought that it was just beta amyloid or tau, now we're seeing other things going on, is still in research. But this conversation that I'm having with you, I was not having it a few years ago. These options about telling you that either you can get this through research or outside at the office, at the clinic, you can get two medications that are being given IV, one every 2 weeks, the other one every month, and that would actually remove those beta amyloid accumulation in your brain, and now you can slow the cognitive decline. Listen, we never talked about this before. We were talking about medicines that just can help a little bit, but we're not treating the underlying problem. So that's promising. I know we're not there yet, and there's side effects that can happen from these medicines, and not everybody's a candidate for that. So we need, unfortunately, to handpick who is the best patient to avoid the side effects that could be brain bleed or edema of the brain, in between others. So that's what is important to know, what is normal for age and when is not normal for age, because we have a window period to give those medicines. And it's not only about medicines, the message that I want to give is about a lot prevention, et cetera, but those patients that actually were doing their prevention and got on time in the clinic, the outcome and the options are different. So, but if people don't know about it, they just don't get on time, right?
Yeah. So I'm going to throw something at you. I'd love for you to expand on it, because I'm trying to live a life of more and more prevention, you know, and I think I have hope that a lot of the things that we see in our parents that we're not going to see in my generation, and that when I get to my parents' age, that the things that I suffer, my kids won't suffer from because of advancements in medicine and technology. There was a paper I read, it was an NIH paper a while, it was probably 4 or 5 years ago. There was a study that was done with, about Alzheimer's specifically, where there was a number of someone had figured out that there was a segment of the population that didn't seem to be getting Alzheimer's at the same rate as others, you know. And this was these nuns that work in convents out in some mountain somewhere, you know, and they try to figure out, like, why is this happening? Like, how are they, when even though they grow older, why don't they experience symptoms of Alzheimer's? So they did a study. I believe the number was 80 nuns that volunteered for their brains to be studied after they passed away. And what they found out was that they, from looking at the pathology of the brain, they had all the plaque and all the things that would have indicated that they should have had Alzheimer's, except their behavior did not. was not, concordant with Alzheimer's disease. And that led to a series of other studies. The conclusion was that, well, this thing called neuroplasticity, right? I mean, these ladies live a life of a lot of movement. They're always moving around because they grow their own food, and they're cooking, they're cleaning, they're going walking from town to town. They're eating very healthy because everything they eat comes from the ground, right? They rotate these things around, so they're challenging themselves. They're challenging the brain, right, in ways that a lot of people at that age no longer do. And the conclusion was that because they kept challenging themselves and challenging physically and mentally, and they slept well, right? The sleep aspect, which was also key. Their brains found ways to rewire themselves through the neuroplastic process. So even though they had the physiological evidence of Alzheimer's, they weren't suffering from it. What are your thoughts on that? And did I understand that correctly?
Yeah, you understood it very well, and that's part of that project that I was telling you that I truly believe in. That is neuroplasticity, but I'm going to tell you an example, the way that I explain my patients. And I use the example of the hurricane just because it struck me, and I think everybody understands that. If you're in my neighbor, and they tell us that a hurricane is coming, I put my shutters, and you didn't. I went and bought, water. You went and bought beers. I put you as a bad guy, you see. and I got all what I need, or what I thought that I need to survive, just in case, right? It may not come, but let's just put that it was a hurricane category 5, and it hit us. But then I was able to survive longer. I was able to manage. I put my shutters, I had my water, you were suffering over there. We got hit by the same hurricane, but the prognosis was different. And I looked much better than you did, just because I was prepared and you were not. So that's the first thing, and I want to talk about cognitive reserve before I talk about neuroplasticity. So cognitive reserve is how I prepare myself for future events. Is that what I just told you? I bought the water, I have my food, I put my shutters, I was ready just in case. So having a higher or a bigger cognitive reserve, it protects you, even though, in this case, the example that you said about the Alzheimer's and the pathology of it, if I have a higher cognitive reserve, I'm able to manage better clinically. So I can live independent longer, even though I may be a little bit forgetful. So we see that, for example, with the doctors, with the lawyers, with whoever after school, after their 12, high school diploma, continue to study, continue to learn something new, are challenged by new things every day. We didn't see that much, unfortunately, on our people, the Hispanics. And you know why? There's a higher incidence of diabetes, there is a higher incidence of high blood pressure. These people work usually 2 jobs because they have to sustain the family. Most of them have to quit, and don't finish even school. So all these other things that I'm telling you are protecting us. So that's the first thing, having cognitive reserve. Second thing would be neuroplasticity. So now, on that brain that perhaps have a very good cognitive reserve, something happened. It could be a stroke, it could be whatever you want, right, in that area. People that have a lot of cognitive reserve are already having a lot of connections between those cells. So I have different paths to send the information from here to here. It's not only one road. They build connections using different cells around them just to get to the same place. So if this connection is lost because of a stroke or because of Alzheimer's, I still can use other connections around. But not only that, the brain can literally, move around and create new connections in between the cells where the damage is or the damage was. But you can do that in cells that are healthy, in cells that can actually, yes, do the connections. You cannot do that in somebody that is smoking, that is obese, that have sleep apnea and doesn't use the machine. That capacity of growing new, new connections is not going to be the same. So neuroplasticity is a very, it's a trending topic, and it's very good. But we need to do, it happens in a healthy brain. It doesn't happen just out of the blue, in somebody that is doing drugs and is, in an exposure of a lot of toxins and that have uncontrolled sugar and all the things that we're talking. That neuroplasticity is not the same, it's not as good as it could be. So we need to have, and we need to work out for that. And having good cognitive reserve, I'm sure that neuroplasticity is going to work beautiful, and it works forever. It's not that it works until you're 60. We have 80 years old, 90-year-old people building new connections in their brain. And we know that because after the stroke, the way that they recover, right? And you see them and you're like, wow, you couldn't walk, 1 month ago, and look at you right now. We know that those connections are being built and are not age dependent. So there's something else that helps with that. And you mentioned a lot of them. Those are the modifiable risk factors. 45% of the risk factors can be modified. And I told you we cannot modify the age, we cannot modify the genetics, but learning something new, and something new is not, I have patients that will tell me, I play Sudoku every day. That's only gonna get you good at Sudoku, that's it. That's that road from here to here. I need road here, I need another road here, another one here. So I need something with music, something with arts, something, so different areas of the brain creating those connections, okay? I'm not telling you to stop doing the Sudoku, but it's just not enough, right? Mm-hmm. Learning something new is challenging, but it's good for your brain. To put you in that challenging position, it makes you try to figure it out, right? And you get tired, and you sit down, and you drink water, and you go again and do it. That's why when we see that the patients actually retire, when they really retire, their brain retired as well. So you can slow down a little bit, that's fine. But like completely do nothing, I mean, that's what you're gonna get. You get slower, your thinking process, you know what you wanna say, but the word is not, it doesn't come out. You know where you store the past information, so the long-term information is the last one to be affected, because that one is already stored there. Mm-hmm. It's the new one that you have to kind of store that becomes a problem. And that starts with even basic stuff about checking your hearing. Sometimes if you don't check your hearing, how do you know? How can you store the information? But not only that, socialization is so important that if you're not hearing well, what do the people do usually? They would just kind of isolate because they cannot participate in the communication, right? So social isolation is another huge thing with memory problems. Other things, you mentioned sleep. During sleep, you consolidate the memories, but also during sleep, we get rid of the trash that is produced from the cells. So if you sleep 3-4 hours and are not, enough, obviously, you start to build up all that garbage in your brain, and at some point you're gonna pay it up.
As the lymphatic system, right?
Yes, that's correct. That's correct. The diet you mentioned, that's so important. How many preservatives and everything that we see in the diet. That's why probably those nuns over there that are, taking care of their own food, and so all the pesticides or the herbicides, all the things that the food has, it affects our brain. Toxicities as well. Interesting, we talk about like the veterans and how they have been exposed to, for example, Agent Orange, the ones that went to Vietnam, Gulf War, and Camp Lejeune. All these things affect the brain, definitely, and they're linked for a higher risk of having Alzheimer's. But nowadays, there was actually a very interesting study published that they follow 1.1 million people in California that live nearby the wildfires. And they followed those patients for 10 years. And the people that were near the wildfires actually have a higher rate of dementia. So how even where we live, right? Like they affect us, definitely. Depression and anxiety is a huge one. Depression, anxiety, stress that increases the cortisol level in your brain. All of those things are linked with Alzheimer's. Deficiency of certain vitamins, for example, and other things like thyroid, like hormones as well. I'm sure that you know the changes in the brain, especially in women, we have seen it since their perimenopause. That decrease in estrogen, we start seeing so much changes that we know, can lead to Alzheimer's later. So there's still a huge field that we can work on. I'm sure, I know the researchers are working on to see how we can attack those problems many years before that condition or those symptoms start to happen. So you see how many, smoking, for example, blood pressure, we spoke already, diabetes as well, so uncontrolled sugar, cholesterol, vision problems, all of those are modifiable risk factors, and I think that's where we should actually do something and try to, prevent and try to put our money on that. Because as I told you the example a little while ago, if we're gonna get the hurricane, we're gonna get it. I cannot change that. But if you're prepared, the prognosis and the outcome is gonna be different.